The opinions expressed in the following program are those of the participants and do not necessarily reflect those of Rogers or Rogers TV.
Welcome to Health Matters. I'm your host, Dr. Lana Marconi. On today's show, we're going to explore men's sexual health, and then we're going to segue into motor vehicle accidents and whiplash. Please welcome my first guest. He's a medical doctor, and he practices complementary and integrative medicine, Dr. Zoltan Rona. Welcome to Health Matters.
Nice to be here.
Thank you. So it's February, it's cold outside. One of the ways couples can stay warm is get intimate and have sex. You're a man, let's talk about men's sex. You wrote a book called Boosting the Male Libido. Want to hold it up for our viewers?
Sure.
All right. Folks at home, if you'd like a copy of Boosting Your Libido, this is for males. Gentlemen, this book is for you. Please email me at giveaway@drlana.com for that book. Before we get into what boosts the libido, let's talk about some of the factors that hinder the male libido.
Well, there's quite a few things. One of the most important ones is your nutritional status. If you're not getting enough protein, enough zinc, enough of B vitamins, nutrients, then that's going to limit your libido. If you have medical conditions like diabetes, high blood pressure, circulatory problems, peripheral vascular disease, if you're taking medications, some medications will have an impact on things like erectile function and also libido. So those are some of the major things that will do that.
What about poor blood circulation?
Sure. Poor circulation, if there's blockages in arteries, if there's a problem with the prostate, for example, in the man, if it's too enlarged, if you have some kind of chronic condition of a genital urinary tract, things that a specialist would have to look after, then all of those things can also inhibit libido.
And how about insufficient nitric oxide?
Well, nitric oxide is that molecule in the body which actually opens or dilates arteries. So there are certain nutrients that will boost nitric oxide, and there are certain drugs, for example, we all know about Viagra and Cialis, and there's a few others. They all basically boost nitric oxide. Nitric oxide opens the arteries, improves blood flow to sexual organs, and as a result of that, it improves erectile function.
So let's talk about Viagra for a minute. What is the Viagra controversy?
Well, there's some controversy about it because it can produce some side effects. It can't be combined with certain medications because, for example, if it's combined with nitrates that are used for treating coronary artery disease, it can actually have an additive effect. It can lower blood pressure in some people too far. It can have effects on your vision and your nervous system. So it may affect color vision, for example, temporarily. And there have been some cases reported of visual blockages. So if people couldn't see for like hours, that kind of thing. Then there are other rare side effects, but those are the most common ones.
What do you think about other types of medical therapies, like the vacuum constriction devices, like the pump in the ring to pull blood, into the penis to hold it there for an erection?
All of those will work, but I think since Viagra came on the scene, those kind of methods have been used less and less. I think also there's, as the subject of my book discusses, there are a lot of natural things that one can do to enhance libido without using drugs.
I know, we're going to get to that. I just want to get into some of the other factors first before we get into that. So in terms of other medical devices, they talk about the syringe, injecting, a medication into the erectile tissue, the corpus cavernosa, in order to help an erection. What do you think about that?
Well, I have a few patients who are doing that themselves, and they're getting excellent results with few side effects. So I think it's a valid treatment, especially for those that are not having any luck with Viagra or any of the other medications or natural products.
And last, I wanted to know about surgery, the prosthesis, the penile prosthesis.
I'm afraid I don't know very much about that one, but I'm sure it's effective, in the right case.
Okay, so let's start to get into your supplements, because you wrote an article in Vitality magazine this February, and in it you talk about the top 10 sexy supplements for men. So the first supplement would be?
Well, the first one, I think probably the most important one is L-arginine. L-arginine is an amino acid, and when you take it in doses of between 6 and 12 grams a day, you can actually increase the amount of nitric oxide in your circulation. That will open the arteries and improve circulation to the pelvic organs. So it does definitely improve conditions like erectile dysfunction. That combined with certain B complex vitamins. There's another herbal remedy which I think works really well, and that's maca, M-A-C-A. That comes from the Peruvian Alps, and it's basically a vegetable that grows at a very high altitude, and as a result of that it has nutrients that other vegetables do not have. And many of the nutrients actually will boost the adrenal glands. The adrenal glands also make the sex hormones, and as a result of taking maca, you can actually boost your levels of testosterone, progesterone, and DHEA and other adrenal hormones.
We'll continue with your sexy supplements, but you just brought up something about the adrenal glands that I wanted to just interject there. DHEA is produced by the adrenal glands and turned into testosterone. And sometimes people take DHEA in the hopes that it will produce testosterone in their body. But there are side effects to it. Like the University of Maryland Medical Center said that taking too much of it could actually shrink the testicles and increase baldness.
Yeah, you have to basically take an optimal dose, and usually between 5 and 50 milligrams for most men would be safe. And in some women who take it, they get acne and they get problems with their complexion, and it may affect their heart as well. So if you take too much of it, you can get circulatory problems and things like heart arrhythmias, and so you got to be careful with these things.
Yeah, so it's always important. There are contraindications for everything that we take, so it's definitely vital to consult with your healthcare practitioner in terms of proper dosage, right?
Absolutely. Yeah.
Okay, so in terms of your top 10 sexy supplements, we went through L-arginine, maca, B complex. We have folic acid and choline.
Yes.
Right? Do you want to talk about those?
Folic acid and choline are important because they're involved in so many neurological transmissions in the body. So, for example, folic acid, many women know that it helps prevent neural tube defects. It also has an impact on the heart and circulation, and it's important to get rid of certain toxins from the system. So, for example, if you're folic acid deficient, your uric acid will build up, so that'll have an impact on you as well. So folic acid is part of the B complex, so taking it by itself along with the B complex is probably the best way of doing it.
We have stinging nettle.
Yeah, stinging nettle and Avena sativa, those are two different herbal remedies, which basically what they do is they cleave the protein part off the testosterone and allow it to be free. So it frees testosterone so that it could work better in the body.
Nice.
So they're basically testosterone liberators.
Nice. All right, hold that thought. We'll be right back. More with Dr. Zoltan Rona and his top 10 sexy supplements for men. Welcome back to Health Matters. I'm joined by medical Dr. Zoltan Rona, and we're discussing men's sexual health and his top 10 sexy supplements for men. Okay, so we went through, just so our viewers know, L-arginine, folic acid, choline, B complex, stinging nettle root, Avena sativa, maca. Let's talk about red clover extract and mura puama.
Okay, those are two different herbs which basically will optimize the sex hormone levels. So they'll boost testosterone if it's low, or if it's too high, it'll bring it down. So they're kind of like adaptogenic like herbs, and they will help with some cases.
Okay, and your last one was saw palmetto.
Yeah, saw palmetto is pretty important because it contains something called beta-sitosterol, and that's something that will actually prevent the prostate gland from getting enlarged. A lot of men have, as they get older, they get an enlarged prostate. So beta-sitosterol is something that will help prevent it from, getting enlarged like that. And it will also be very good to put into many of these formulas that have these different herbs in it, so that if the testosterone levels go too high, that the saw palmetto is there to prevent some of the bad effects of the wrong kind of testosterone from causing the prostate to get enlarged. So it's kind of like a backup for people that are using these stimulants, these high testosterone stimulants.
Right. So when a man becomes aroused, nerve signals are sent to relax the smooth muscle tissues of the penis, allowing arteries to pump more blood right into the compartments of the muscles. If a man has prostate cancer, if he has a prostate cancer treatment, does that interfere with the nerve signals and perhaps even the arteries?
It's quite possible that it could, depends on the kind of treatment, but it's important for men to have lots of sex, not for any other reason than the fact that if you want to prevent prostate cancer, prostate enlargement, the more you empty the prostate, the less likely it is to stagnate and cause some enlargement in the gland itself. So sex in a way is therapeutic.
Because the prostate has fluid that nourishes the sperm.
That's right.
Okay, so speaking of sperm, I have a story for you.
I'm sure you do.
Okay. So an Aussie man, he's 20 years old, he's working with his dad, and he's a construction worker. He's noticing that his testicles are getting swollen, but he doesn't want to complain about it because he's a man, right? So he wants to ignore it and hope that it goes away. This is how he's explaining the story. By the time he does get himself down to the doctors, his sperm count is 0. And the doctors don't know if it's due to the epididymis, the tube that carries the sperm, if there's an infection in there, or if he's just stopped making sperm. And the only way they can tell, they can't tell through X-ray or ultrasound, they have to actually do surgery to tell. This is how he's telling his story. He said the process is very emasculating. And he said he wished he would have listened to the symptoms and got himself down to the doctor prior. So his message to men was, don't wait so long. If there's something wrong, with your testicles or your penis, go to the doctor and get checked. So do you notice that men maybe are embarrassed to come to you about maybe a sexual issue that they have? Or what would your message be?
Yeah, I do notice that women are much more likely to complain about these kind of issues than men are. But I often will try to ease their fears by telling them the best thing to do is to maybe let's just get an ultrasound done that's painless and there's no radiation involved. And that's going to be able to tell us a great deal, not only about the prostate, but also about the testicles. So I try to encourage them to do that at least, and then obviously if there's some serious issues, then they would have to be sent to a specialist. But you're quite right. That's one of the main problems with most men is that they don't want to deal with this.
Yeah, and I mean, he didn't realize how important the privilege was to be a father when it was actually taken away from him. So for him, it was like, well, what woman is going to want to be with me now if I can't create a family? So those are issues that he was going through. What can gentlemen do to protect their sperm or to keep their sperm count high?
Well, I think part of the answer is to follow a healthy diet and not, to avoid as much as possible sugar, coffee, tea, alcohol, tobacco, smoke, anything that is a toxic substance out there that can potentially harm your organs. So I try to encourage people to follow basically a healthy diet and avoid all those kind of things that can possibly injure the sperm. Yeah,
there's a French study that came out that men who were obese had were 42% more likely to have a low sperm count than their counterpart men who were not obese. What do you think about fish? Because you talk about fish in your book that it's not something that you would recommend. And the reason I ask you, because a Harvard study did a study, they gave men processed meat, white meat, red meat, and then they gave them white fish, tuna, and salmon. And the men who ate the white fish had a higher sperm count than the other men.
Well, that could be because of the content of omega-3.
Yeah.
Omega-3 fatty acids are very important. I would tell most people that get your mercury blood level checked, because one of the problems with fish is that all of them seem to be more and more contaminated with mercury. And mercury is a neurotoxin, and it can cause a lot of different neurological conditions. So, and it can also suppress your immune system. So you don't really want to get loaded up with mercury. One of the antidotes for mercury is selenium. It's a mineral, and about 200 micrograms a day should protect you from any of the mercury that you may be getting from fish and seafood. Another supplement that may help you there is chlorella. Chlorella is one of the algae products, and it seems to trap heavy metals quite nicely, particularly mercury.
I wanted to talk to you about pheromones.
Pheromones, yes.
2020 did a cute little experiment. They had twins, gentlemen and ladies, and they each had fragrances. They didn't really know what was in the fragrances. I think it was synthetic pheromones in one of them. So one of the guys got the pheromones and one of the ladies got the pheromones. They went on at a restaurant, speed dating, 10 dates in 5 minutes each. And what happened was the gentleman, the guy that had the pheromone fragrance, had more dates than his brother, and the woman had more pheromones in her fragrance, had more dates than her sister. So do pheromones really make us hot?
I think they do, and I think some women are able to sense them and smell them much better than other women, and men are not that good at smelling the pheromones. I don't know what men look at these days, because it's been a long time since I was young, but in any event, I think women are the most likely ones to be able to pick it up, and there's definitely truth to the fact that, you know, that does attract the opposite sex.
There's a cute quote in your book by Bette Midler that you write, and it says, if sex is such a natural phenomenon, how come there are so many books on it to do it? How come there are so many books on sex?
Well, I wrote one too. So.
I know.
I don't know. It's a good question. I think it's very topical these days, and one of the things that's been happening is that more and more men are becoming impotent. More and more couples are infertile. So why is all this happening? I think a lot of it is because we have a lot of what are called xenoestrogens in the environment. We have a lot of things that simulate hormones, chemicals, and as a result of that, our hormone balances are way off, you know, and a lot of this is synthetically produced.
We have to stay away from the synthetic chemicals. Thank you very much, Dr. Zoltan-Rona, for being here. And we'll be back more on Health Matters, taking a look at auto accidents and whiplash injuries. Stay tuned. Get plenty of rest to maintain a healthy immune system. This is vital to warding off colds, influenza, and other ailments. Research shows that sleep deprivation depresses the immune system's disease-fighting abilities. Even a single night of poor sleep can impair the immune system, making you vulnerable to illness.